Okay, team. Last week we talked about HB 1033. A ton of you had questions. That is North Carolina's dental board reform bill, and specifically how dentists might lose the right to elect their own members. A lot of you had feelings about that, and I love it. Well, this week we're going to dig a little bit deeper into that bill, and I want to talk to you about a provision that sounds alarming on the surface, but once you understand where it comes from, it might actually make a little bit more sense. The bill includes language, and this caught me very much off guard. It includes language that says the dental board cannot order an unlicensed person to stop practicing dentistry. Only a court can do that. And if you've been a fan of the show for long enough, you know I've reported time and time again about another foreign trained dentist performing dental services, or maybe not even a foreign trained dentist, just a rando person in their garage making dentures, taking teeth out, and doing dentistry and charging people money. And then ultimately the people get hurt and they go file complaints with their dental board and file lawsuits against the unlicensed practitioner. Now, in an ideal world, you would want the dental board to go in and shut that person down. Now, I need you to understand that it's not this reform bill that may be the issue. Now, before you close us down, here's what you need to know. That restriction already exists. It's been the law of the land since 2015 when the U.S. Supreme Court ruled against the North Carolina Dental Board in a case that started with mall teeth whitening kiosks. And I was there for it all. But here's the part that should make every dentist angry. The board was trying to protect the patients, as I'm sure you know. Dentists were seeing people walking in with chemical burns and gum damage from these unlicensed operators. When they went to cease and desist them, they got sued for antitrust violations. Now, the court said the problem wasn't what the board did. It was who was sitting on the board. Too many active dentists, not enough state oversight. So HB 1033 is the legislature's answer to that ruling a decade later. Whether it actually solves the real problem, that's a different conversation. And it doesn't really dig into how North Carolina Dental Board, or any dental board, because this applies to all 50 dental boards, how they protect the public by shutting down unlicensed operators while they're in violation of this antitrust law of the land in that ruling in 2015. This has to be worked out. Dental boards should be able to go in and shut down unlicensed dentists immediately and allow that to be worked out in the court, as opposed to how it currently operates, because it's of an antitrust competitive landscape. They are not allowed to shut down an unlicensed dentist if the dental board is made mostly of dentists, which most of them are. They can't shut it down because of competition. They have to wait for the court to file an injunction to go and shut the individual down. Meanwhile, they continue practicing dentistry. Lots to uncover in this HB 1033 and lots of debate. I would love your comments in the comment section so we can dive into that a little bit deeper. All right, story number 2. If you've been frustrated watching that hygiene schedule go unfilled for months, well, Virginia is trying to solve that problem. We have story after story after story on workforce issues here on the podcast. And Virginia, as are many other states, are bringing forth some unique answers. Governor Spanberger signed 2 workforce bills last month that take effect July 1st, only 3 weeks away. Here's what changes. First, internationally trained dentists can now pursue dental hygiene licensure in Virginia. They have to pass the National Board Hygiene exam and complete a clinical assessment. But if they do, they can start treating patients in a preventative capacity. The ADA called it a responsible pathway for providers who were previously sitting on the sidelines. The second part was qualified dental assistants can now perform supragingival scaling and coronal polishing under dental supervision. Other states and federal systems have been operating with these revised laws for a while. So Virginia was paying attention and decided that this would help them offset a dental hygiene workforce issue. Not an opinion. Would love your comments in the section below. Let us know how you feel about moving into expanded function with dental assistants. The Virginia Dental Association was in support of both bills to help resolve issues they were currently identifying in rural and underserved areas. Another state, Illinois, made a quiet change on Jan 1, trying to also solve a hiring gap. This one's kind of interesting, and I kind of like this story. You know the scenario. A new graduate finishes dental school, passes their boards, submits their license application, sits in limbo for weeks or months waiting for approval while there's an open chair, maybe with their future practice, and their student loans are starting to amass. Well, Illinois decided to stop that practice. As of this year, dental graduates who have completed their education, passed their exams, and submitted a proper application can now practice under supervision while they wait. The supervising dentist is responsible for oversight, and that supervision has to be real and documented. But a pathway for dentists to get to work and start earning an income while they're waiting for the documentation. So I think that's an interesting alternative, and the first I've seen of that particular nuance of moving forward. Now I bring this story up because of our guest tonight, so I hope we can dig into this a little bit. Let's talk about a number. 91%. This was an American Dental Hygiene Association study that just came out in April, reporting that 91% of dentists are actively trying to hire a dental hygienist, and they describe the search as very or extremely challenging. 78% of all practices have at least one unfilled position right now. We haven't solved the workforce issue. There are a few things that seem promising. The pipeline does seem to be opening up a little bit. Hygiene school enrollment was up 16% since 2020, and last year had the most graduates ever. That's progress. But we know that the gap between the number of dental hygiene students that are graduating and the number of dentists that are graduating is pretty significant. So we would have to see an exponential leap and dental hygienists entering the marketplace to start to close the gap. I'm going to love to hear Katrina's opinion on this, because I think we as dentists have to be working very closely with our Dental Hygiene Association and our dental hygienists in particular to solve this problem collectively as a profession, because too many are just waiting to solve it for us. And with that, that's the news.